It's December 17th, the evening before my surgery. It is 11:06. There were a couple of things I wanted to add to my previous video, and those were my concerns or fears, and I'm sure that anybody else who's going through these things probably have them as well. My biggest fear is not dying. When I look at, I did a lot of research online. I was trying to find people who've had bad experiences with gastric sleeve. And although statistics show that it's 1 in 400 people who die, I think that 1 in 400 people or a person is probably a person who's not very healthy. I want to tell you a little bit about my health. So I'm 43 years old. I just turned 43 on December 9th. When I had the lap band, I was in perfect health, other than the fact that I was overweight. I swear to God they rigged that blood pressure machine in order for me to be accepted, because my blood pressure is always really low. It's usually like 90 over 60. Maybe at the most it's 110 over 80. But when I went to, I won't name the place, but when I went to my previous hospital provider, they always measured my blood pressure like off the chart somehow. So I think that was just a way of sort of getting me the surgery. I was 217 pounds when I had applied. I don't know what that was in BMI, but it was enough. And I had no other health issues. No diabetes, no cholesterol issues. My blood work is perfect. No, low blood pressure. I can't think of anything other than eczema. That's it. I have eczema. I suffer from it. I've had it for like 14 years. But other than that, nothing. No problems. And then I got the lap band. And the first year was not so bad. Trouble getting used to sort of how much you have to chew, how much you can eat, and deciding that yes, I can eat that, no, I can't eat that, oh, that'll get stuck for sure. So that was fine. There were the usual issues when you first come out. Your diet, of course, is limited. And then, of course, I always had this pain in the left shoulder that's due to the gas that they use. And I was worried, was that a heart attack? Left shoulder pain is supposed to be a heart attack, but it's not. It's gas. And then after a few years, I started developing lots of other issues, though. And most recently, over the last year, pain. And I've had heartburn issues for at least, since at least the second year, maybe even during the first year. I can't recall exactly when it started. Got the lap band in August of 2007. And for the last 2 years or so, the heartburn has been unbearable now and then. And I've taken medicine, and the problem with medicine is that it doesn't really help enough. I noticed that if I didn't eat, I'd get heartburn. If I ate the wrong thing, I'd get heartburn. If I drank, like even a Propel, the only thing I could ever drink anymore is coffee, water, and iced tea. Everything else gives me heartburn. I, of course, cut out sodas right away, so that was no problem. But then there would be surprises like, ooh, I ate some fruit and had mint in it. Oh, never touch mint, ever. The worst heartburn ever. But I had never even experienced heartburn before the lap band. Never experienced heartburn. Didn't know what it was, didn't know what it felt like. And after the lap band, that was the big issue. So the whole gastric, the reflux, all that other stuff became really bad. Plus, then there was pain too. The throwing up was maybe once in a while. It wasn't that much. Maybe once a week. Well, I guess it wasn't enough. Sometimes once a week. Sometimes once a month. It just depended on what it was, whether I was really careful about what I ate. But I started getting pain in my lower left side. I have no idea. Even Dr. Moon, my new doctor at Kaiser, doesn't quite know what it is, but he says when he opens me up, he'll take a look. Other than that, I'll probably get a colonoscopy soon. So pain in the lower left that was never there before. Sometimes I'll experience pain, and I know the actual band is lower than this, but I would get pain up here. It makes it feel like the band is way up here for some reason. So that was bad. So those are the reasons for getting rid of the lap band. And even my doctor says that he was once a proponent of the lap band, but more and more he realized that it was just a bad idea and he doesn't recommend it anymore for anyone. And if you look at statistics, I think like half of the people who've had them have taken them out for whatever reason. A friend of mine just got one in April, and I should have probably been a little bit, probably should have talked to her a little bit more. I didn't think that she was actually going through with it at the time. But I had told her recently that I'm switching to this, and she said she's had no problems yet, but basically said, just wait. You don't usually have problems in the beginning, but eventually it gets bad. So don't believe in that putting a foreign object into your body, especially onto a moving part of your body, is a good idea anymore. Anyway, my fears. So when I first got out of lap band surgery, I remember waking up completely nauseated and blah, blah, like dry heaving. And I was just miserably sick, like I'd been on 50 roller coasters, um, and just really, really ill. That's my big fear. So my big fear is coming out. I know it sounds horrible, but my big fear is coming out of surgery and feeling sick to my stomach because I hate that feeling. And then the other really bad part of the lap band surgery was they hook you up to an IV, and you have to drag that thing around with you even to the bathroom. And that night I spent in the hospital was the longest night ever because I couldn't sleep. I had to pee every 30 minutes, if not less, every 20 minutes. The stupid IV makes you have to pee all the time. And the nurse even tried to bring me a bedpan. Would love a bedpan. No, a bedpan, because I told her I have to get up every 20 minutes. I can't sleep. It's horrible, horrible. Do something. And she brought me a bedpan, and there was no way I could pee in a bed. How can you pee laying down? It just made no sense to me. And I remember one of the nurses was this young man, is probably mid-20s, and I didn't care. I didn't care what he saw. I had on one of those gowns that was completely open to the back with my ass hanging out of the back. I was like, whatever. I don't care. Just get me to the bathroom. So that was miserable. And then the waiting to do the whatever that thing is called, where they make you swallow the stuff and then look at your your insides. That took forever. So finally got released the next day. And then getting home, just the soreness, moving around. So I think that's the problem. And I think this will be definitely worse than getting the lap band. I'm not sure. Some people, when I see them in their videos, they seem to be like, okay. They're like just, all they're complaining about is a dry throat and feeling like they got kicked in the stomach. I'm not worried about pain. I'm worried about discomfort. I think discomfort is worse in a weird way. I don't know. Because pain, you could just keep pressing that button for that morphine. Or you can complain about pain and they'll do something about it. But discomfort, that whole having to get up and move all the time to pee, feeling like you're going to throw up all the time, that's my big fear. So we'll see how it goes. I'm taking my iPhone with me. I don't imagine that I'm going to videotape myself when I'm nauseous. But I might. We'll see. Oh, God. Anyway, I'm going to bed at 11:15. Get up, take my shower, get ready, and I'm all good to go. Bye-bye.